Good afternoon, Mayor, councilors, everyone. My name is Yoli Diaz. We've requested a meeting with your staff to speak on the city's authority, responsibility, and opportunity to address gaps in access to healthcare for indigent residents. We will be asking for your support and approval. The City of Las Cruces created the Telshore Fund from the lease of Memorial Medical Center. Those funds are public resources and carry with them a clear public purpose to benefit the health and welfare of this community. At the same time, Doña Ana County operates an indigent health care program pursuant to New Mexico law, with the responsibility to provide care for qualifying residents. However, when gaps exist, particularly in access to hospital-based services and diagnostics, there is both a policy and legal basis for intergovernmental collaboration to address those gaps. New Mexico law expressly allows local governments to enter into joint powers agreements and memoranda of understanding to provide services that serve a public purpose. This includes the ability to pool resources, avoid duplication, and ensure continuity of care across jurisdictions. Given the documented concerns regarding barriers to hospital care over the past decade, the city is justified in taking corrective action that directly supports access to care. For that reason, I am requesting that the city enter into a memorandum of understanding or joint powers agreement with Doña Ana County and allocate $500,000 from the Telshore Fund to the county's indigent program, specifically restricted for diagnostic services and medically necessary care resulting from a diagnosis. This proposal is grounded in three key policy principles. First, access to care. Diagnostic services are an essential entry point into the healthcare system. Without them, conditions cannot be identified or treated in a timely manner, undermining the effectiveness of all downstream care. Second, fiscal responsibility. Funding diagnostics reduces higher downstream costs associated with delayed treatment, emergency care, and uncompensated hospital services. Early intervention is widely recognized as a cost containment strategy. Third, accountability. Where a public asset, such as a formerly city, county-owned hospital, has not fully met community expectations for access, it is appropriate for the city to use available public funds to mitigate those impacts and ensure residents are not left without options. An MOU or JPA structure would also provide necessary safeguards, including defined eligibility, restricted use of funds, reporting requirements, and measurable outcomes. This ensures transparency and alignment with the intended public purpose of the Telshore Fund. This is a legally permissible, policy sound, and fiscally responsible action that directly advances the health and welfare of the community. I respectfully urge the city to consider, support, and move forward with this proposed partnership and funding allocation. Thank you for your consideration.